Governor Scott, it's great to see you.
Nice seeing you.
Well, I want to talk real quickly about the Florida economy. It's come roaring back since the economic crash here.
Jobs, jobs, jobs.
You promised jobs, and jobs we are getting, but still, if you look at certain poll numbers, you're still lagging behind in the upcoming governor's race, not yet official yet. But tell us how you plan to use the economic success of Florida to close that gap that some polls say exist.
If you go back to 2010, I ran on a campaign to get our state back to work. The state had lost 832,000 jobs under Charlie Crist in 4 years. Unemployment rate had gone from 3.5 to 11.1%. The private sector has added 600,000 jobs, and unemployment's down to 6.2%, below the national average, I think, for 8 or 9 months in a row. So when I talk to families, and I talk to families all across the state, they're a lot like my family growing up. You know, they didn't have a lot of money in the bank. My parents struggled to have jobs, and they want jobs. And so that's what I work on every day. So it's exciting how many people want to move to our state for jobs. We have over 260,000 job openings in our state, and that's what our families care about.
One of the fastest growing economies, state anyway, in the country right now.
We're learning to brag about our state a little bit too. We have so many good things going on in our state. We should brag more like Texas does.
Yes, no shortage of bragging rights for Texas and one of your friendly rivals, Rick Perry. And folks who live in Florida have seen more of you on TV lately in commercials, and there's a great ad, and we'll try to show it here, of you and your grandson.
That was fun.
That was fun, and I think it's a very effective ad, and it helps soften your image. Is that something you're trying to work on a little bit with that ad particularly?
Well, what I do is I tell this story. If you look at our ads this year, I've told this story. I grew up in public housing. I watched my father's face when the only family car got repossessed. I know what it's like when he lost his job. I know the importance of a job. I had the opportunity to serve in the Navy, and that's why, like what's happened with these VA facilities, it really bothers me. So we're telling our story, and now I have grandchildren, the best thing in the world. And my little 2.5-year-old, we did an ad together. He was good with Grandpa, let's get to work. Sitting for 30 seconds to do an ad, not so much.
I like the newspaper, a little surprise there. Let's talk about the VA Medical Center in just a second, but quickly I want to ask you about the Medicaid expansion, because depending on which state you look into, there are different results in different states. What are you finding in Florida? Because you're one of the Republican governors who actually accepted the Medicaid expansion, a little bit controversial.
Well,
Medicaid, I should say.
Well, we didn't do the Medicaid expansion. What we did in 2011 was we did Medicaid reform, and it's working. If you remember, Medicaid, which is the program for those that can't afford their own health care, was growing, the cost was growing for taxpayers at 3 times our general revenue. So we had to figure out how to do this, take care of the recipients, but at a price that taxpayers can afford. So we passed it in 2011. We finally got federal approval in 2013. And now we have companies that are saying we're responsible for these patients and taking care of them. So it's great what happened. Now separately with Obamacare, it's causing all sorts of problems in our state. We have people losing their plans, which is the opposite of what the president said. They're losing their doctors, which is opposite of what the president said. We have Medicare Advantage, which is a successful program being rated to pay for Obamacare. And we're seeing rates go up. So that's what the problem right now with Obamacare is.
And some hospitals are reporting, a lot more people coming into the emergency room, people who didn't have insurance before or didn't think they had the access to insurance before. And there was some concern about the viability of the federal money long term. What's the status of that right now?
Well, I didn't change my position. The legislature didn't go along with doing any more Medicaid expansion. But here, let's remember with our problem right now. People are losing their plans. They're losing their doctors. We're seeing premiums go up. That's what's happening in our state. So Obamacare is not working. It's hurting patients and hurting families. And eventually it's going to have an impact, I think, on jobs because taxes went up under it.
What did you think when you heard Charlie Crist wrap his arms around Obamacare saying it was a great thing? Was that, you see a big opportunity opening up for you here in this race?
Well, he keeps saying that's great. It's great for who? I mean, it's not great for patients in our state. It's not great for taxpayers in our state. It's not great for people who want to start a business in our state. So I'm not sure who it's good for when people are losing their plans, losing their doctors. Medicare Advantage is being rated for Obamacare. I don't think it's great for anybody.
All right, let's talk about the VA medical centers. Florida has come up in this. The center in Miami is one of the areas that's been highlighted having some problems here. You're a former hospital executive. If you were tasked with fixing the problems at the VA medical center, where would you start?
Well, you have to start with new leadership. We've got to have accountability.
So you would say get rid of Eric Shinseki right now?
You have to. I mean, what's happened since we've heard of these problems? We don't hear of anything happening. Here's probably my biggest disappointment. We have a state agency that goes in and helps hospitals. If there's a problem, they do an investigation. How can we help? What can we do to create a better process? We sent them in to all of our VA facilities, and they're turned away. So if they're focused on improving care for our veterans, which is what we should be doing, they wouldn't have turned these individuals away. So what you would do is you'd say, okay, here's our problem. Let's look at what, compare our facilities, who's doing something better. Let's find best practices. That's what we used to do when I was in the business. And let's share them, but let's give people all the information. Who's the best at bypass surgery? Who's the best at knee surgery? Who's the best at this? What are they doing differently than somebody else?
And if you drill down into this problem, you say leadership is really the only thing that's going to change the current situation here. Do you think that, one of the ideas that's been floated is maybe shifting some of these people on the backlog over to the private system? Do you think that would work? Would that be effective?
Well, here's the way I sort of think about government. Government wants to provide a service, all right? We have to provide it the most, who can provide the best service and who can provide it at a price that taxpayers can pay for. So we ought to look at the VA, look at any government program and say, who should do the service? Can somebody do it better than the VA is doing it? Let them do it. Can they do it at a better price? Even better.
So maybe put it out for a bid or something.
Absolutely.
Like that. And do you see any scenario in which eventually the VA could be eliminated altogether through a voucher program or some other means?
Well, I think the way to do it is, let's think about the veteran. That's who we ought to be taking care of. What's best for them is whoever can provide the best care for them. If a VA facility can't, that's great. If another hospital can provide the best service or a doctor, that's what we ought to be doing. We ought to find what's best for the veteran. I mean, I had the opportunity to serve in the Navy. My dad was in the 82nd Airborne in the Second World War. I think of my dad all the time and the individuals I served with. They ought to get the best care. This ought to be all for what's best for the veterans.
As a veteran and a second-generation veteran, has this become somewhat personal for you?
Well, I care about. I think of my dad when he was sick. I want him to get good care. I think about my friends I served in the Navy with. I want them to get good care. We have 1.5 million veterans in our state. I want them to get good care. But yeah, it's very personal to me that somebody that went and defended our country and defended our freedom and they're still doing it, they're going to come home and not get good care. That doesn't make sense.
It doesn't make sense, and that's why I think this story has gained so much traction. As we look at the success of different Republican governors around the country, we talk about states being incubators of ideas. We have these national debates, immigration being one of them. And Florida is trying something, or talking about doing something in terms of giving undocumented teens access to in-state tuition. What's your standpoint on that right now?
My focus is, my goal since I've been in is reduce tuition for everybody. I asked our state colleges if they could do $10,000 complete four-year degrees. They all did it. Our universities started raising tuition 15% a year. It's a bill that Charlie Crist got passed. 15% a year. How many families are seeing their income go up 15% a year? So if you're a poor family or middle income, the goal of university was going away. So what I focused on was, let's get rid of that 15% increase. We did this year. Also, if you grew up in our state, you ought to have the same in-state tuition as your peers. We want you to do well. We're a great melting pot.
Does the state have an economic interest in making sure those kids that the state has already paid for to educate through elementary school, and middle school, and high school, keeping them in our state so they can become taxpayers?
My goal is that it doesn't matter what country you came from, what family, what zip code, you should have the chance to live the dream. The American dream, part of it is get a great education. And so if you want to go on to higher education, you ought to be able to afford it. You shouldn't be at a disadvantage to your peers. That's the way I think about it. I want everybody to have I got to live the American dream. I mean, start out in public housing, not even knowing my natural father, having a good mom that really pushed me. I want the same dream for everybody.
I still remember your mom from the other campaign, the donut shop commercial, which is another good one.
She was wonderful.
I want to end on this, though. There are a lot of critics in the Republican Party who say anything like this, whether it's giving tuition or any sort of pathway to citizenship, is some sort of amnesty. What do you say to folks who say if you give undocumented students in-state tuition, you're capitulating to the left or the people who want to embrace immigrants maybe in a different way?
Well, we're a country of legal immigration. Our federal government has absolutely failed us. They haven't secured our borders. They don't have an immigration policy that's working. That's why we have the problem. And what states are dealing with is the fact that our federal government has not done their job. They're still not doing their job. And so while they don't do their job, we've got to make sure that our citizens have the opportunity to live the American dream, and that's what I'm doing.
All right, Governor Scott, great to talk to you, and good
Thanks,
luck out
Andy.
there on the campaign trail.
All right, thanks.